Skin cancer affects about 1 in every 5 people.
Dr. Allison Vitamos is chairman of the Department of Dermatology at Cleveland Clinic.
The number one kind of skin cancer is basal cell carcinoma, and it affects about 1 in every 4 to 1 in 5 individuals. And it's most commonly seen on sun-exposed skin of the head and neck, the chest, the backs of the hands. Second is squamous cell carcinoma, and again, there's about 1 million cases of squamous cell carcinoma in the United States every year. And again, it is seen most commonly on the sun-exposed skin of the head and neck, backs of the hands, the tops of the ears, the lower lip. Melanoma is our biggest fear for young and old patients, and it is from chronic sun exposure. We tend to think of it as being caused more by brief hits of heavy exposure. Blistering sunburns are an example. And we ask patients to look for any new or changing moles, any moles that bleed, and certainly come in and get them checked when they see something like that. But the risk of melanoma at this time is about 1 in 68 individuals versus 1 in 4 for basal and squamous cell carcinomas.
What else can a skin cancer look like?
Skin cancers can present in a variety of ways. They can be a little shiny bump with blood vessels at the surface. They can be a scaly, eroded, or skin broken at the surface area. It can be a scaly spot that looks like eczema. And the key thing for patients is to know that it's something that doesn't go away. It should be checked.
Dr. Vitamos says, look for the ABCDEs.
Asymmetric, border, color variegation. A good mole is the same color throughout. A bad mole has different colors of brown and black and red and white and blue. D is diameter. Diameter greater than 6 millimeters is a slightly higher risk for a melanoma. And then we've added E for elevation, so a mole that was previously flat becomes elevated. It should be examined.
Ways to avoid it altogether?
Most importantly, avoid the peak hours of sun throughout the day, which are generally between 10 a.m. and 2 p.m. Wear broad-rimmed hats, sunglasses, use a sunscreen, at least an SPF of 30. And we ask patients to apply the sunscreen 30 minutes before they go out into the sun and reapply it every 2 hours. You want to look for a product that's water resistant, so it will state that it stays on over 40 to 80 minutes, and apply enough to your skin surface so that it's effective. So in other words, we ask people to apply an ounce, a shot glass, to their whole body, and we know from studies that patients tend to put less than they're supposed to put on, so we shoot for high numbers, hoping that they'll get an SPF of 30 with the amount that they're applying. It's wise that patients do a skin check on themselves once a month, get in front of the mirror, front and back, and just look for anything that's new or changing, and if there is a suspicious growth, go in and see your dermatologist.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.